Outside of the commonly heard LGBTQIA, there are lots of other terms that exist to describe people in this community. So let's try and learn a few. Pansexual, or pan, is that term used to describe anyone who is sexually, romantically, and/or emotionally attracted to anyone, regardless of their gender or identity. Demisexual is that person who can only experience sexual attraction after an emotional bond is formed. GREYSEXUal are those persons that do not prioritize sexual attraction when it comes to choosing a romantic partner, and sex for them may not seem as important as it does to the rest of the population. There may be sexual attraction sometimes, but it's not often there. Gender non-conforming are basically those persons who do not conform with what are supposed to be social and cultural expectations of their perceived gender. Aromantic, that person who experiences little to no romantic attraction to anyone. When it comes to gender identity and expression, we have to understand what pronouns are. You might have heard of that before. Now, pronouns are basically words that you can use to describe someone without using their name. Very common pronouns are he, him, she, her, or they and them. Persons in this community may experience something called gender dysphoria, which is basically a psychological distress when a person's gender identity does not match the sex that they were assigned at birth. You may have come across the term binary before, which is basically the concept of dividing sex or gender into two clear categories. Sex is male or female, and gender is masculine or feminine. And non-binary is just someone who does not exclusively identify with either being male or female. There is also the term two-spirit, which was originally used by Indigenous people to describe those persons who identify as having both a masculine and a feminine spirit. Then there's genderqueer, which are those persons who reject conventional categories of gender and embrace more fluid ideas regarding gender. These are basically persons whose gender identity can be both male or female, or neither male or female. Gender fluid is for that person who does not necessarily always identify with one fixed gender. Their gender may change at any point in time. When it comes to gender transition, there is no one way to transition, and it can include things such as social, meaning new name and pronouns, medical, including hormone therapy or surgery, and legal, in terms of changing a driver's license or birth certificate. Persons nowadays are very much aware and educated about the different types of surgeries that exist that can help you in transitioning. So let's mention a few of those. This will basically come under gender confirmation surgery, which is just that process that helps persons align their body with their gender identity. There is bottom surgery, which is the surgery that we do to change our genitalia. There is top surgery, which you do in your chest area. And then there is something called binding, which are different techniques or methods that people use to make their chest area appear more flat. A lot of persons may already have knowledge as to where they stand on the spectrum, as to what terms define them. And of course, then there's the entire process of telling other people. So let's look at out versus closeted. Coming out is a very complicated, multi-layered, and ongoing process in which one is discovering and accepting their own sexuality and gender identity. Outing is publicly revealing someone's sexual orientation or gender identity when they have not come out as yet. Living openly is any person in the community who lives their lives publicly and accepts their gender identity and sexual orientation. And closeted is a person who either cannot or will not accept their sexual orientation or gender identity just yet. So here's to understanding a little bit better the LGBTQ+ community, what they stand for, and how they describe themselves, so that if we come across someone who is unsure or on that path of discovering themselves, we can be supportive and helpful. So I hope this was of some use to you, and you take care and have a great month.